is a common condition that occurs when one or more of the pelvic organs shift from their normal position and bulge into or outside the vaginal canal. The pelvic organs that can be affected by pelvic organ prolapse include the uterus, the bladder, the rectum, and in some cases the small bowels. Pelvic organ prolapse can cause a range of symptoms and significantly impacts a woman's quality of life. Pelvic organ prolapse occurs when the muscles and tissues that support the pelvic organs becomes weakened or damaged, causing them to descend from their normal position. This can lead to a variety of symptoms and may result in the protrusion of organs into the vaginal canal or outside the body. Pelvic organ prolapse can be caused by a combination of factors, and this includes childbirth, age-related changes, hormonal fluctuations, and lifestyle choices. The following factors can contribute to the development of pelvic organ prolapse. Let's take a look at childbirth and pregnancy. The stretching and weakening of the pelvic floor muscles and tissues during pregnancy and vaginal birth can increase the risk of pelvic organ prolapse. Also, the natural aging process can lead to a loss of elasticity and strength in the pelvic floor muscles and connective tissues. Fluctuations in hormone levels, particularly a decrease in estrogen during menopause, can also contribute to the weakening of the pelvic floor support. Chronic straining during bowel movements can place increased pressure on the pelvic organs and contribute to the development of prolapse. Excessive weight and obesity can strain the pelvic floor muscles and contribute to the development of pelvic organ prolapse. Conditions such as chronic obstructive pulmonary disease or consistent and persistent coughing can also place strains on the pelvic floor muscles. Repeated heavy lifting or activities that place strain on the pelvic floor muscles can also increase the risk of pelvic organ prolapse. There are different types of pelvic organ prolapse based on the specific organs involved. Let's take a look at cystocele. This occurs when the bladder bulges into the front wall of the vagina. And then there's the rectocele, where the rectum protrudes into the back wall of the vagina. A uterine prolapse involves the descent of the uterus into the vaginal canal or outside the body. Vaginal vault prolapse occurs when the top of the vagina descends after a hysterectomy. Enterocele refers to the protrusion of the small bowel into the vaginal canal. The symptoms of pelvic organ prolapse can vary depending on the specific organs involved and the severity of the prolapse. Common symptoms may include a heavy or bulging sensation in the pelvic area, often described as a feeling of something coming out of the vagina. Vaginal pressure or discomfort is also common. A sensation of incomplete emptying of the bladder or bowels, urinary problems such as incontinence, frequent urination, or difficulty starting and stopping urination. Bowel problems include constipation or difficulty with bowel movements, pain or discomfort during sexual intercourse, lower back pain or pelvic pains. Diagnosing pelvic organ prolapse typically involves a combination of medical history and physical examination. The healthcare provider will inquire about symptoms, medical history, childbirth experiences, and any other relevant factors contributing to prolapse. A pelvic examination will be performed to assess the position of the pelvic organs and the degree of prolapse. The examination may be conducted with the patient lying down or in a standing position. In some cases, additional tests such as urodynamic testing, cystoscopy, or imaging studies such as ultrasound scanning or MRI may be conducted to evaluate the function and position of the pelvic organs. The treatment of pelvic organ prolapse depends on the severity of symptoms, the impact on daily life, and the individual's preferences. Mild to moderate cases of pelvic organ prolapse can be managed conservatively. This can include pelvic floor exercises such as Kegel's exercise, Lifestyle modifications such as weight loss or avoiding heavy lifting, use of pessaries, which are devices inserted into the vagina to support the pelvic organs, and physical therapy. In cases where conservative measures are not effective or the prolapse is severe, surgery might be recommended. Surgical options can include repairing and strengthening the pelvic floor muscles and tissues, removing the uterus, or using mesh or other graft materials to support the pelvic organs. In some cases, hormone replacement therapy might be prescribed to postmenopausal women to improve the strength and elasticity of the pelvic floor tissues. While pelvic organ prolapse cannot always be prevented, the following measures may help reduce the risk of progression of pelvic organ prolapse. Performing pelvic floor exercises, such as the Kegels exercise, may help to strengthen the muscles that support the pelvic organs. Maintaining a healthy weight can reduce the strain on the pelvic floor muscles and tissues. Minimizing activities that involves heavy lifting or straining, as this can increase the risk of pelvic organ prolapse. Seeking appropriate treatment for chronic conditions that can contribute to pelvic organ prolapse, such as chronic cough or constipation, is important. Maintaining regular bowel movement and avoiding straining during bowel movements by consuming a fiber-rich diet and staying hydrated. Smoking can increase the risk of chronic coughing, which can strain the pelvic floor muscles. Hence, quitting smoking can act as a preventive measure. As we conclude this segment, it's important to understand that pelvic organ prolapse is a common condition that can significantly impact a woman's quality of life. Understanding the causes, the symptoms, diagnosis, and treatment options for pelvic organ prolapse is essential for women's health. Prompt medical attention, lifestyle modifications, conservative measures, or surgical intervention can help alleviate symptoms, improve quality of life, and restore pelvic organ function.